Hello everyone, welcome back to my channel. Today's topic is benign squamous papilloma. As you can see in this particular picture, this is the benign squamous papilloma, and we'll be going through its clinical features, causes, and histopathology, lastly the treatment. This is the excised lesion, what you can see over here. And the clinical features are exophytic growth made up of numerous small finger-like projections. Exophytic means which is proliferating on the exterior of the epithelium. Then it is roughened, verrucous or cauliflower-like surface. Okay, जैसा कि आप ये देख सकते हो, it has a cauliflower-like appearance. This is quite rough, it's not smooth. Okay, and it has finger like projections, means फिंगर की तरह इसके प्रोजेक्शंस बाहर निकलते हैं, जैसे कि आप इस पिक्चर में देख सकते हो. It is nearly always a well circumscribed pedunculated tumor, occasionally sessile. Now what do you mean by pedunculated and sessile? Okay, it means it has a stalk which is attaching this particular lesion to the epithelium. Okay, that is called pedunculated, and it is occasionally sessile. Sometimes, that is very rare, when it is attached directly by the base of the lesion to the epithelium and not by the stalk. It is painless, usually white, but sometimes pink in color. इसमें पेन नहीं होता है, white दिखता है. White क्यों दिखता है? Because इसमें keratin present होता है, and keratin के absence में pink दिखाई देता है. Intraorally, it is found most commonly on the tongue, lips, buccal mucosa, gingiva, and palate. Okay, कहाँ पे दिखता है? टंग में, लिप्स पे, बकल म्यूकोसा. ओके, जो ये चीक के अंदर वाला पार्ट होता है उसको बकल म्यूकोसा बोलते हैं. जिंजाइवा मसूड़े पे, पैलेट में. द मेजॉरिटी ऑफ पैपिलोमा आर ओनली अ फ्यू millimeters in diameter, but lesions may be encountered which measure several centimeters. These growth occurs at any age and are seen even in young children. Okay, then what is the cause behind it? There's a virus called human papilloma virus. Okay, and especially behind this particular lesion, it is number 6 and 11. This particular virus is not seen in malignant lesions. Okay. There is something called common wart or Verica vulgaris. This is a frequent tumor of the skin analogous to the oral papilloma. It is uncommon in oral mucous membranes but extremely common on the skin. Okay, these look like the clinical features looks like oral papilloma, but these are not found on mucous membrane like oral mucous membrane. Okay, these can be found on skin. The associated viruses in Verica are the subtype HPV2, HPV4, HPV40. Okay, and in papilloma it was HPV6 and 11. Verica vulgaris is highly contagious and can spread to other parts of the body. You can see in this picture. Okay. Then there's one more important thing which is known as Cowden Syndrome, where you can see such papillomas along with microcephaly, trichomonas, that is benign hair follicle tumors. Then there's delayed development, intellectual disability, or an autism spectrum disorder. Let's move on to histologic features, where you can see these finger-like proliferations. Okay. This is the fibrovascular core. Here you can see squamous cells and papilla. This is the diagrammatic representation, and this is the histologic picture which you can see over here. The microscopic appearance of the papilloma is characteristic and consists of many long finger-like projections extending above the surface of the mucosa, each made up of a continuous layer of stratified squamous epithelium and containing a thin central connective tissue core which supports the nutrient blood vessels. Okay, this is what we saw over here. Some papillomas exhibit hyperkeratosis, which is secondary to the location of the lesion and the amount of trauma or frictional irritation to which it has been subjected. Okay, if it has gone through a trauma or frictional irritation, then it will have more amount of keratin. The essential feature is a proliferation of the spinous cells in a papillary pattern. The connective tissue present is supportive stroma only. The connective tissue present is supportive stroma only and is not considered a part of neoplastic element. Next important histological feature is cholosides. These are the HPV altered epithelial cells with perinuclear clear spaces and nuclear pycnosis. What is pycnosis? It is the shrinkage or condensation of a cell with increased nuclear compactness or density. These may or may not be found in the superficial layers of the epithelium. Okay, so here you can see ये क्लियर है पेरीन्यूक्लियर स्पेस और ये पिक्नोटिक न्यूक्लियर. ओके, और ये सुपरफिशियल लेयर में कभी मिल सकता है, कभी नहीं मिल सकता है. The presence of chronic inflammatory cells may be variably noted in the connective tissue. Lastly, we have treatment and prognosis. Treatment of the papilloma consists of excision, including the base of the mucosa into which the pedicle or stalk inserts. Removal should never be accomplished by an incision through the pedicle. If the tumor is properly excised, recurrence is rare. ओके, तो इस पर्टिकुलर लीजन को कम्प्लीटली एक्साइज करना चाहिए. अगर अच्छे से एक्सेशन किया है तो रिकरेंस नहीं होता है, लाइक इट्स वेरी रेयर. अगर नहीं अच्छे से एक्साइज किया है तो रिकरेंस हो सकती है. थैंक यू सो मच. सी यू इन द नेक्स्ट वीडियो.